In this video, we will try to imagine and understand the functioning of an emergency department of a hospital. An emergency department, ED, also known as an accident and emergency department, A&E, emergency room, ER, or casualty department, is a medical treatment facility specializing in emergency medicine, the acute care of patients who present without prior appointment, either by their own means or by ambulance. The ED is usually found in a hospital or other primary care center. Here's a general overview of what happens. Triage. Upon arrival, patients are assessed by triage nurses, who prioritize them based on the severity of their condition. This process ensures that those who have life-threatening conditions are treated first. Registration. Patients provide personal information and details about their health insurance for hospital records and billing purposes. Medical evaluation. Depending on their condition, patients are seen by a team of healthcare professionals, which may include doctors, nurses, and specialists. This team provides immediate treatment and decides if further diagnostic tests are needed. Tests and procedures. Patients may undergo various tests, for example, blood tests, X-rays, CT scans, to diagnose their condition accurately. Treatment. Treatment can include medication, surgery, stabilization, and other medical interventions. Observation. Patients might be kept in the ED for observation to monitor their progress and ensure stability. Admission or discharge. Depending on the patient's condition, they may be admitted to the hospital for further treatment or discharged with instructions to follow up with their primary care physician or a specialist. Referrals. If specialized care is needed that is not available at the current facility, a transfer to another hospital may be arranged. Emergency departments are equipped to handle a broad range of medical emergencies and are staffed 24/7, ensuring that care is available at all times. We have already discussed the important events that happen in an emergency department, so now we can clearly identify them. Further, we will now also try to guess the data that can be collected or possibly originate during each of such events. For example, in the triage stage, we can guess that the following information are collected or noted. 1. Basic information about the victim who has suffered the accident along with details of those who have brought him or her in the hospital. 2. The medical person or the team who checks the victim. 3. Everything about the physical and mental condition of the victim when he or she arrives there. 4. The case history or the statement that is received from the person who brought the victim over there. 5. Recommendation for the next step. We will now document it in form of a mind map in the manner shown above. Then we will repeat this exercise for each of the events that take place in emergency department. This exercise can help us to identify the entities in the later stage.